Hi, you guys. Welcome back for our daily practice question. It's day 6 of our daily questions, but y'all know I like to first get into my introduction and disclaimer. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number 1 for today. Question number 1 states, which of the following is a common characteristic of a Ptergyium? Is it A, it is a benign growth of the cornea, often located on the temporal side? B, it's a benign growth of the cornea, often located on the nasal side. C, it appears as a yellowish spot on the cornea and is often asymptomatic. Or D, it always leads to visual disturbances or blindness. Take a moment and tell me what you got in the comments, you guys. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you, right? And here, the stem is the question is the stem, right? So it states, which of the following is a common characteristic of epitergium? Your best answer is B. It's a benign growth that can extend on that cornea, but is often located on the nasal side. Remember that, the nasal side. It usually starts on that nasal side and it stands out, okay? Question number 2, which of the following is the most common risk factor for developing a ptergyium? Is it A, smoking, B, excessive UV light, C, family history of glaucoma, or D, high blood pressure? Take a moment and tell me what you got. All right, so stem of the question is the question here again. So which of the following is the most common risk factor of developing a ptergyium? And it is B, excessive UV light. All right, so now let's apply what we know to a scenario, okay? So, question number 3, a 55-year-old female presents with a history of long term outdoor activities such as gardening and hiking. She reports, excuse me, noticing a gradual growth of a triangular shaped mass on the nasal side of her eye. The growth has caused mild irritation, but she has not experienced any significant vision changes. Upon exam, the mass is pink, triangular, and it extends on the cornea. You diagnose her with ptergyium. What is the most important step in managing this patient to prevent further progression of the ptergyium? Is it A, a surgical excision of the ptergyium? Is it B, prescribing topical corticosteroids to reduce inflammation? Is it C, advising the patient to wear protective sunglasses and a wide brim hat to reduce UV exposure? Or is it D, oral antibiotics to prevent infection? Take a moment and tell me what you got in the comments, y'all. All right, all right, all right. Stem of the question, what is the most important step in managing this patient to prevent further progression of the ptergyium? Y'all, and I'm probably jacking that word up, but y'all know what I'm talking about. But what is the most important step in managing this patient? So what do we have going on? Because we're saying management, so that's treatment. What do we need to plan and treat at this stage, right? So we have a 55-year-old female. She comes in. She has long-term history of doing outdoor activities. She does a lot of gardening and hiking, right? So that lets us know that she is exposed a lot to the UV light. She reports noticing gradual growth of the triangular-shaped mass. Clear description of ptergyium. We say that we have already diagnosed her with this, right? So the thing that you want to do is advise her to wear protective sunglasses. And also, you may see this as protective UV glasses as an answer choice or things of that nature. So just make sure that you know that you're trying to protect them from excess UV light exposure, right? So you want to make sure you're wearing those protective glasses as well as a wide brimmed hat to help her as well, since she's outside and getting a lot of exposure from like gardening and hiking, etc. Okay, so C is your best answer. All right, you guys, I just wanted to give you a quick tip. If you probably see this month, I have been going a little heavy on EENT. We'll be working through this. You will see some videos where you can study along with me and we'll work through my review book as we review these things as well. And then each month we'll kind of hit systems so that I am guiding you on through. If there are certain things that you struggle with, anything in EENT that you may have common difficulty with, let me know. Put it in the comments, shoot me an email, whatever. And I'm happy to include those in the rotation. But as always, I hope you found this helpful. Be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. All of the things that I do offer, to include my review book, the paperback as well as ebook, are linked in the bio of this channel. My digital flashcards are linked in the bio of this channel. All of my QBank options are linked in the bio of this channel. So all of those tools and resources, the self-paced review course is linked in the bio of in this channel, as well as my website. So if you need any of those resources to study on the go or to study independently, those things are linked there for your access. And if you're looking to book any of my one-on-one sessions or any of my custom plans, I always say feel free to either call, text, or email so that I can gauge what you truly need to make sure you're booking the appropriate session type. Okay. Um, as far as those, I do have two more slots for private 4 week one-on-one sessions for this month. So if you're looking to get in and get ready for boards within 4 weeks, then grab those last two slots, either call, text, or email me. All right, you guys, y'all know what to do. Happy studying. Bye, y'all.